This is the second in the series of managing diarrhea, and we continue on with the need for a thorough assessment. We haven't finished that yet. Let's continue on to gathering information. What is the usual pattern of the bowel movements? Is this quite different from the usual? Has there been some new food intolerance? Have they eaten something unusual, perhaps eaten out at a restaurant recently? If the patient is receiving tube feedings, have they changed the formula or the amount per each feeding? Have there been any changes in medications just recently? Perhaps there's a new antibiotic that was started for an infection about something else. Does the patient have an actual disease process such as colitis, Crohn's disease? Has the patient been in the hospital recently and perhaps picked up C. difficile? It can be transmitted there very easily, unfortunately. Has there been any past history of chronic diarrhea, or is this a brand new pattern? How about recent radiation therapy or chemotherapy? One last thing. Has the patient been overusing laxatives? Many older people have a habit of using laxatives for constipation, and then they're on the roller coaster of alternating constipation and loose stools. All of these things would be considered even before you begin your interventions. Let's say your assessment turns up a change in the tube feedings. Remember, in hospice, we are generally not using tube feedings to prolong life. So perhaps it is an indication of the need for a discussion about the goals of care for the patient. Remember, as a hospice patient is declining, the body is wanting to be quiet. Feedings and foods are not absorbed normally. Perhaps a reduction in the amount is needed, or a reduction in the concentration of the tube feeding. Take a moment to really think about it. If the tube feeding is the issue, please speak to your medical director, the patient, and the family to really determine the goals of care and what the next step should be in tube feeding. Okay, setting that aside, now all the assessment has been completed, and we're going to talk about the treatment of diarrhea that can really be undertaken. So let's move on to treatment of diarrhea in the next video. As always, visit us at thehospicecareplan.com, where you can get your booklet, get involved with our daily blog posts, ask your questions, make comments. We learn from you too. Get us on Amazon. Click on the link below. Get your copy of the Hospice Care Plan, A Path to Comfort. Subscribe to our site. And all of that is to keep you and your loved ones on the path to comfort, because care is treatment.